Arthritis is a word to describe pain or discomfort, stiffness, or swelling of a joint. There are many different types of arthritis. Rheumatoid arthritis is the most common type of inflammatory arthritis and affects at least 1% of the population. It is also considered an autoimmune condition where the immune system attacks itself. For example, when one gets an infection, the immune system produces antibodies to fight that infection. With rheumatoid arthritis, the immune system is producing antibodies, but there is no infection. As a consequence of these antibodies, inflammation and damage occurs to normal tissues. Patients with rheumatoid arthritis typically experience morning stiffness and discomfort lasting 45 minutes or longer. In addition, the joints are typically swollen and may feel warm. It is important to diagnose rheumatoid arthritis early. Early diagnosis and treatment can help prevent damage and deformity of the joints. By acting early, patients are more likely to be able to continue working and function normally without disability. While rheumatoid arthritis can affect both men and women, women are 2.5 times more likely to develop the disease. It can affect children too, but the peak incidence occurs between the ages of 30 and 40. The hands and feet are the most commonly involved joints, but the knees, neck, hips, ankles, and shoulders can also be affected. Diagnosis is based on the patient's history, physical exam, laboratory, and imaging such as X-rays. Patients with rheumatoid arthritis typically have elevated measures of inflammation in the blood. The blood tests that check for inflammation are called the sedimentation rate and the C-reactive protein. Most patients, but not all, will have antibodies or abnormal proteins called rheumatoid factor or cyclic citrinated peptide. The abbreviations for rheumatoid factor is RF, and the abbreviation for cyclic citrinated peptide is CCP. Not all patients with a positive rheumatoid factor in the blood have rheumatoid arthritis. On the other hand, a very high CCP antibody is typically associated with rheumatoid arthritis. If at all possible, it is best to start treatment before there is bone and joint damage to have the best chance of disease remission. Rheumatoid arthritis is considered a chronic disease, so most patients will need to be on medications indefinitely to control the illness. Treatments may consist of non-pharmacological therapies such as diet and exercise, topical therapies such as Voltaren gel, analgesics such as Tylenol or Tramadol, NSAIDs such as high doses of naproxen, ibuprofen, or meloxicam, steroids such as prednisone, and steroid injections. The disease-modifying drugs and the biologics are the cornerstone for treating patients with rheumatoid arthritis. The disease-modifying drugs have been available for many years. Examples include Plaquenil or hydroxychloroquine, which is the generic, asulfidine or sulfasalazine, which is the generic, methotrexate, or Arava. Since 1999, biological DMARDs have been approved, and these include the first one being Enbrel or etanercept. Others that came shortly after include Remicade or infliximab, Humira or adalimumab, Orencia, Actemra, Cimzia, Simponi, Rituxan are all other biologics that not only help the symptoms of rheumatoid arthritis, but also help prevent damage to the joint, thereby decreasing the risk for disability. Methotrexate is the cornerstone of treatment for people with moderate to severe rheumatoid arthritis. Methotrexate is an excellent medication, but it does, like all medications, have potential side effects. Some of the side effects with methotrexate include liver damage, so it's important not to drink if you take methotrexate or have a history of underlying liver disease. Methotrexate rarely can cause lymphoma. Methotrexate can sometimes affect the blood counts, increasing your risk for infection. Methotrexate also can be associated with a life-threatening inflammation of the lungs called methotrexate pneumonitis. In patients who take methotrexate and develop cough, shortness, breath, or fever, they need to stop the methotrexate and be seen immediately. Finally, if you're considering pregnancy or there's a chance of pregnancy, methotrexate should be completely out of your system, as it may take over 3 months for methotrexate to be out of your system, and if methotrexate is in your system and you get pregnant, there is a significant increased risk of teratogenicity or birth defects. The same is true with Arava, but unfortunately just stopping the drug Arava does not get the medication out of your system. It requires regular use with another medicine called Questran, which is a resin binder, and taking the appropriate number of doses of Questran can get the Arava out of your system so pregnancy can be considered. It is recommended that you have 2 blood tests checking the blood level of Arava before you consider conception. Like methotrexate, Arava can too affect the blood counts and cause elevated liver tests, which can lead to liver damage. Plaquenil is a relatively safe medication that has been associated with eye toxicity, and early in the treatment may be associated with mild rashes. Occasionally the rashes may be quite severe, requiring high-dose steroids. Asulfidine is a medication that, like Plaquenil, is often used in patients with mild disease. In the first 6 months of therapy with asulfidine, one is more likely to see problems affecting the bone marrow, so blood counts and liver tests need to be closely monitored. Like many medications, asulfidine can cause rashes, sometimes very serious rashes. For patients with moderate to severe disease who have not responded to methotrexate, or there are reasons they should not take methotrexate, the biological DMARDs are often the drug of choice. The biologics on the market include Enbrel, Humira, Remicade, Orencia, Simponi, Cimzia, Rituxan, and Kineret. The biologics work very quickly, and they may be very effective in not only helping symptoms but also preventing damage to the joint. The biologics, unfortunately, have some potentially serious side effects, the most important being an increased risk of serious or life-threatening infection. Patients need to be screened for tuberculosis prior to starting a biologic, and if they have exposure to tuberculosis, need to be treated. In addition, patients who have a prior history of hepatitis B may find that their disease becomes reactivated if they take a biologic, so this too needs to be checked for before starting a biologic. If you have a history of recurrent infections, or possibly a history of certain cancers like lymphoma, or a neurological condition like multiple sclerosis, a biologic such as Enbrel, Humira, or Remicade may not be the best treatment for you. Hopefully, through a conversation with you and your doctor, you'll be able to come up with the right treatment option for you where the benefits of that particular drug outweigh the potential for side effects. Once again, the goal of therapy for people with rheumatoid arthritis is to get them diagnosed and treated early to help prevent damage, deformity to the joints, as well as subsequent disability. Just because you have arthritis does not mean you have rheumatoid arthritis. Patients may develop arthritis symptoms from a virus. In that case, the problem typically goes away within several weeks. Other causes of persistent joint pain include osteoarthritis, which is the most common type of arthritis and is uncommon before the age of 40. As opposed to rheumatoid arthritis, patients with osteoarthritis typically have minimal morning stiffness that lasts less than 30 minutes. Go to naturalarthritistreatment.com to sign up for timely information on arthritis, as well as future videos on causes of joint pain, such as osteoarthritis, psoriatic arthritis, lupus, gout, fibromyalgia, ankylosing spondylitis, Sjogren's syndrome, and more. If you have joint pain that lasts longer than 2 weeks, is associated with swelling of the joints, or requires regular use of medication, it is recommended that you see your primary care physician or a rheumatologist. If you'd like more information on arthritis, please visit my website at www.scottzashinmd.com.